Equity and inclusion. Equity and inclusion are of significance in the sanitation and hygiene sector. Providing access to the different categories of people who are not able to access and use safe sanitation facilities shall be a priority of the implementing agencies. Women, children, people of certain caste, faith and ethnicities, older people, pregnant women, people with disabilities, Divyangjan, geographically marginalized populations in remote areas, as well as those living in areas where it is difficult to construct simple toilets due to high water tables, sandy soils, or hard rock may be given priority while planning for coverage. These categories of people may also include, among others, those who are socially and economically marginalized and those who are unable to use sanitation facilities constructed with standard designs. Requirements and sensitivities relating to gender, including dignity and safety issues, shall be taken into account at each stage of planning, implementation, and post implementation management of sanitation issues. Girls and women have hygiene and sanitation needs linked to their menstruation cycle. Women suffer in the absence of knowledge about safe practices on MHM. There are several examples where CSOs and SHGs have worked with the community, informed them about safe menstrual hygiene practices, and also developed economic models to meet the demand for sanitary napkins. This is one area where CSOs and SHGs can play a key role. Funds available under the IEC component may be used to raise awareness and skills on menstrual hygiene management, specifically amongst adolescent girls in schools. IEC plans should include an MHM component for raising awareness among all stakeholders. Funds under the SLWM component can also be used for setting up of incinerators in schools, PHCs and public toilets for the safe disposal of menstrual waste. Many elderly pregnant women, parents with young children, sick or injured persons who have difficulty with balance, squatting or lifting, etc. Inclusive planning of water and sanitation services benefits the larger community, and therefore provision of accessible sanitary facilities shall be made during the construction of toilets. Suggested models and cost estimates shall be prepared and circulated for the same. Accessibility of persons with disabilities to all community toilets constructed under SBMG. Provision for accessibility to disabled persons may be made in all community toilets constructed under SBMG. Solid and liquid resource management. The objective of SBMG is to bring about improvement in the cleanliness, hygiene and the general quality of life in rural areas. Solid and liquid waste management is one of the key components of the program to create clean villages. To this end, it is essential that the IEC interventions focus on solid and liquid waste management so as to create a felt need for these activities among the population. This must lead to the setting up of systems for scientific disposal of waste in such a way that has an intangible effect on the population. The community or Gram Panchayat has to be motivated to come forward, demand such a system and subsequently operate and maintain. Once the demand is created to ensure that the resources are used efficiently, SLWM is to be taken up in project mode for each Gram GP with financial assistance capped for a GP on the basis of number of households to enable all GPs to implement sustainable SLWM projects. The total assistance under SBMG for SLWM projects shall be worked out on the basis of total number of households in each GP, subject to a maximum of rupees 7 lakh for a GP having up to 150 households, rupees 12 lakh up to 300 households, rupees 15 lakh up to 500 households, and rupees 20 lakh for GPs having more than 500 households. Funding for SLWM project under SBMG is provided by the central and state government is in the ratio of 60:40. Any additional cost requirement is to be met by funds from the state or GP and from other sources like Finance Commission, CSR, Swachh Bharat Kosh and PPP model. Under solid and liquid waste management, the following activities inter alia may be undertaken. For solid waste management, states are to decide the technology suitable to their areas. Technologies identified by the committee on technologies may also be considered for implementation. Collection, segregation and safe disposal of household garbage. Decentralized systems like household composting and biogas plants shall be permitted. Activities related to maximum reuse of organic solid waste as manure should be adopted. Such technologies may include vermicomposting or any other composting method, individual and community biogas plants. Funds allocated for solid and liquid waste management may be used to implement safe disposal solutions for menstrual waste. Used sanitary cloths and pads, or setting up incinerators in schools, women's community sanitary complexes, primary health centers, or in any other suitable place in village, and collection mechanisms, etc., can be taken up. Appropriate technologies that are socially acceptable and environmentally safe may be considered. For liquid waste management, states are to identify suitable technologies and may focus on maximum reuse of liquid waste for agriculture purposes with least operation and maintenance cost. For collection of wastewater, low cost drainage or small bore system soakage pit may be adopted. For treatment of wastewater, the following technologies inter alia may be considered: waste stabilization pond WSB technology, duckweed based wastewater treatment, phytoride technology developed by NEERI, anaerobic decentralized wastewater treatment. For details on the technologies suitable for rural areas, a handbook on technical options for solid and liquid waste management in rural areas and other publications issued by the Ministry of Drinking Water and Sanitation may be referred to on the Ministry website under publication. All GPs are to be targeted for coverage with an SLWM project. SLWM projects for each GP should be part of the annual district plan. The annual district plan should be approved by State Level Scheme Sanctioning Committee SLSSC. Each individual SLWM project may be approved at the DWSC level as per the technical and financial rule of the individual states. Every state should have at least one SLWM consultant at the state level and one SLWM consultant in each district, DWSM or DWSC, to guide the preparations of the SLWM projects for each GP. Assistance of professional agencies, NGOs may be sought to prepare, develop, test or implement such projects. The project preparation, supervision and monitoring cost of SLWM projects payable to such agencies may be made a part of the project cost itself. Maintenance cost for the first 5 years of operation may be made a part of the project cost. SLWM projects can be made financially viable by dovetailing funds from other programs and sources of funding like MGN REGS, MPLAD, MLA funds, finance commission, CSR contribution, Swachh Bharat Kosh, donor funding, etc. Funding from programs of other ministries and departments may also be converged. Sustainable operation and maintenance systems have to be put in place before the SLWM projects are taken up. The Ministry of Drinking Water and Sanitation shall publish information and manuals including technical information on SLWM on the MDWS website from time to time. Administrative charges. States shall be permitted to utilize funds under this component as per requirement. The administrative charges shall normally permit expenditure on salary of temporary staff and agencies deployed for the execution of various components of the SBMG at state, district, block and GP levels, support services, fuel charges, vehicle hire charges, stationary monitoring and evaluation activities, TADA interstate and interdistrict survey teams deputed for monitoring and verification and exposure visits. In order to implement the projects professionally, specialist consultants, agencies from the fields of IEC, human resource development, school sanitation and hygiene, education, SLWM, monitoring and evaluation, etc., may be hired at the state and district levels for the project period. Governments are advised to post a government officer as a full-time block sanitation officer. Until that is made operational, the state governments may officially assign SBMG activities to a senior official posted at the block level. He or she may be assisted by a block coordinator and a data entry operator engaged on contract who shall be provided emoluments to be decided by state. This block level arrangement shall be tasked with hand-holding, supervising and monitoring every GP in the implementation of the scheme. Every block shall be provided with one computer with accessories. Internet connection including monthly charges shall be permissible per block. Administrative components to be utilized annually will be up to 2% of program expenditure in a year. This will be adjusted at the district level where the authority will be to incur expenditure of 1.8%. The state will be authorized to incur expenditure up to 0.2% of total program expenditure of all districts taken together. Sharing pattern of expenditure will be 60:40 between center and state, which will be adjusted at the end of financial year. Unspent balance in this component will be carried over to the next year. To ensure that monitoring and evaluation activities are carried out in the states, 5% of all the funds available at the state level for administrative expenditure shall be utilized for relevant monitoring and evaluation studies of the program. State will make arrangements for concurrent monitoring and social audits. Third party or independent evaluations and impact studies may also be conducted by reputed national level agencies empaneled for the purpose. The following items or expenses are specifically prohibited under administrative expenses: purchase of vehicles, purchase of land and buildings, construction of official buildings and rest houses. This excludes toilet units needed for SBMG projects. Expenses for any political party and religious organizations, expenses for gift and donations, temporary transfer of funds to any other scheme or fund in the state,